You can press the down arrow.
Oh, can I? You're so smart, dude. Has anyone ever told you that?
First time.
You know, it's an article that was written up, I think, within days of Phillip Adams' CTE diagnosis, right? So I want to go through it. I'm not going to go through it word for word, but, you know, let's hit some important points because I want to sort of translate what the media puts out based off of a story, right? Because I think that's really important, especially with the sensationalism of CTE in the media, okay? So let's just go through it. Phillip Adams, right, it describes what he did. It describes that he was diagnosed with CTE and describes that Ann McKee, who's a neuropathologist at Boston CTE Center, examined the brain and where she examined the brain and then what she found, right? So suffered from severe frontal lobe damage. What do you think about that?
So again, you know, luckily we actually got to hear the words of Dr. McKee in her press conference. She said severely predominant in the frontal lobe, but that the case is a diagnosis of stage 2, which is not the severe stage. So it's a misrepresentation.
Right. So with them saying there's severe frontal lobe damage, there wasn't severe frontal lobe damage. There was severe clumping of tau in the frontal lobe.
Unusually severe.
severe.
There's all these terms that make the actual finding somewhat difficult to know.
Right.
So an unusually severe predominance of CTE pathology in the frontal lobes for stage 2.
Right. Okay. And then we have, they kind of describe what CTE is, neurodegenerative disease linked to concussions and repetitive head trauma. Would you agree with that? I think I agree with that.
Repetitive head trauma.
Yeah. Has been associated with behavioral and mood changes, according to Mayo Clinic and multiple studies. That's not a stretch. I think that's pretty accurate.
Mm-hmm.
Yeah. All right. Keep it moving.
The original finding in boxers of dementia pugilistica and write-up of
the punch drunk
initially, and then dementia pugilistica, discussed that this was prevalent in something like 17% of boxers.
Okay.
So whereas I think the media portrayal of that is also out of proportion. Nevertheless, the description initially of CTE was behavioral changes in the context of a neurologic disorder with a head injury exposure history.
Okay.
So not behavioral changes on their own.
Right.
In the context of a neurologic disorder, such as Parkinsonism with tremor and movement problems and so on. And so that was the initial description, and then that was extrapolated later in 2005 to cases of diagnosed CTE in football players.
With behavioral changes.
With behavioral and cognitive changes.
And those are regarded as neurological dysfunctions, or they're not frank neurological dysfunctions?
The point that I'm making is that, seeing behavioral changes alone was never a clue to autopsy someone's brain, and was not found as a sole symptom finding in life that was associated with CTE pathology in these boxers. It was behavioral problems in the context or with a neurologic problem, which was a motor or movement problem.
So do you think we're casting too wide of a net with nonspecific behavior?
There are studies now that have looked at traumatic encephalopathy syndrome, which is a research term used to describe a set of criteria that's attempting to get closer to accurate diagnosis just based on symptoms in the living person for CTE.
Got it.
And so the initial criteria was not accurate, and there was actual terms was not specific. It was overly sensitive. It caught a lot of the cases that went on to, based on retrospective viewing of symptoms, had CTE pathology on autopsy. But if those were used to diagnose people in life who had behavioral changes and a repetitive head injury exposure history, it would diagnose some extra 80% or so of people who just have a mental health problem at that age and an exposure to sports.
Right. So real quick, so they use that criteria, and certainly using their criteria, I'm sure they caught a lot of people that had CTE on the autopsy after they implemented the criteria when the person was alive. But it sounds like they also implemented that criteria and then autopsied the brain of that person after they passed away.
This was all retrospective.
Oh, it was retrospective.
The studies from those who created the criteria were retrospective assessment of symptoms in life, and then making a diagnosis and looking at autopsy to see if it matched.
Okay, but did they ever use that criteria and they did not find CTE?
It was more sensitive. I don't know if there were certain cases where they false.
Because that's what you're alluding to, right? Is like you have this huge catch area of like any behavioral symptom, right?
I don't know the degree to false positives, but that's the point.
That's the point.
The specificity is bad, meaning that there
probably was a high false positive rate.
Right.
Okay.
And then in a separate study done by a separate group, looking at that criteria, they would overdiagnose a number of people. They did it on people who were living. They used those criteria.
Right.
They would overdiagnose a number of people who likely would not go on to have CTE.
Got it.
Because of the overlapping symptom criteria with things like depression, anxiety, and other mental health problems, just because these individuals had some exposure to repetitive head injury.
Yeah. Let's keep going. So of the possible link between violence and CTE, McKee said, so we have seen this behavior. We have even seen homicidal behavior in other individuals diagnosed with CTE. True, right? Aaron Hernandez. It's difficult to say it alone resulted in these behaviors because usually it's a complicated issue with many other factors.
Yep.
Pretty straightforward.
Yeah.
Yeah. And that's exactly what we've been saying. All right. But certainly we have seen this behavior, and it is in fact not what I would consider unusual in this disease. What do you think?
There's I don't recall the exact quote on this, but I think there's a few sentences around this one sentence that was pulled from the press conference in which she discusses this more. I think the terminology...
Do you want me to move up? I moved past it already.
Yeah, just go back. The fact not, and it is in fact not what I would consider unusual in this disease.
There's so many like double negatives, man. It's just like
the point. I think is that it has been seen.
Right.
It is unusual for footballers to develop these types of behaviors, and in the few cases that were found related to CTE, that still is a very small proportion of all cases that were found to have CTE.
Right.
So I think it is unusual, but there's a lot of things about the case that are similar to other cases like Aaron Hernandez's that help to build a case for Dr. McKee to say this.
Right.
I just don't, the point is, though, that this is unusual for NFLers in general, and it is unusual for cases of CTE.
Yeah. Now, I just think, why is it unusual? And we can allude to what we talked about before, which is like all these other factors sort of have to line up, right? Whether that's, and again, this isn't the case, but whether that's the frontal lobe atrophy or the particular clumping of tau in the frontal lobe, as well as a genetic predisposition, as well as anything else that you described previously. That might be the reason that it's unusual. Again, right? We don't really know, right? The science just isn't there yet for us to identify.
I think that's a reasonable guess, though.
You think so?
Is that,
nice.
Just
nice.
like in every other condition that is progressive, neurodegenerative, or that controls or modifies behavior, it is probably complex and multifactorial. And, just based on the studies of aggressive behavior and antisocial personality disorder or psychopathic behavior, these things are likely a result of multiple pieces going wrong or affecting an individual's ability to kind of behave normally.
Yeah, let's move. Adams had stage 2 CTE, with stage 4 being the most severe, according to McKee. You agree with that, right?
I do.
That's right. Most severe pathologically.
Right.
Right?
Yep. A CTE is a pathological diagnosis.
Right, because can you say stage 4, if they had stage 4, they're going to have the most severe symptom. You can look back and you say this person had the most severe symptoms in their life.
So there's two things that the literature bears out about stage 4, or about the increasing stages. It's linked to older age.
Right.
So if you have a repetitive head injury exposure history, and you die of older age, and you've donated your brain to one of these brain banks, you're more likely to have stage 4 diagnosis of CTE, so more tau pathology throughout the brain. And you're more likely to have a diagnosis of dementia or dementia symptoms from a doctor at some point retrospectively looked at in your life.
Interesting, yeah.
So stage 4 is associated with those two things. Having stages 1 and 2 is associated with less likely having a diagnosis of dementia or dementia symptoms in life, and occurring at a younger age.
Okay.
So 30, 40 years old is common for those patients' brains in the brain bank to have a diagnosis of stage 2.
Okay.
So it's not uncommon for, in this case, it's not unexpected that he would be stage 2.
And then it talks about where Adam's played at, right? Played college football, South Carolina. We played in the NFL for several teams.
Another point that the media covers, I'm not sure if this article does or not, but is that it seems that Adams played since the age of 7.
Okay. Yeah, it doesn't mention it in this article. I don't
and
think.
6 years in the NFL, and that each year you play in the NFL gives you an increased chance of developing CTE based on these retrospective analyses after autopsy.
Okay.
And so I think that brings up this other debate, which we can talk about, where the age of first exposure, AFE, is a predictor of developing long-term symptoms, worse cognitive outcomes, and/or dementia diagnosis in life, or related to CTE pathology on autopsy. And so there's been a debate in the field and in the literature of some studies showing age at first exposure, particularly for NFLers, if they were exposed to football prior to the age of 12, were more likely to have CTE or higher stages of CTE on autopsy than those who did not start playing football until after, or those who started playing football after age 12.
Okay.
Subsequent studies, though, have looked at, from other groups, age at first exposure and a variety of outcomes in prospective studies, in living people, in college, in older adulthood, and 20s, 30s, 40s, and even up to 50s and 60s, in recent studies showing that there is no link between age at first exposure or group difference for those exposed before the age of 12 and those exposed at 12 or later, and cognitive outcomes, mood outcomes, behavioral outcomes. And so the debate's open. More research needs to be done. Maybe it's just NFLers with that extreme amount of exposure that if it started before the age of 12, then they're more likely to have problems. So jury's out on that, but that is a massive debate, and it actually spurred policy changes and things like that in certain states about playing football before, helmeted, kind of padded football before the age of 12.
Right. So, and I think that's the issue with, okay, you develop CTE, but do you also develop symptoms, right? So I think that's the disconnect. So certainly you can find CTE on the autopsy, right? But then how does that actually translate? And I think that was a question being asked when they did these prospective studies, right? It's like, okay, or are people actually affected? Because, right, if that's an absolute, if you play before 12 and you're going to develop CTE, then at some point, if that translates to symptom burden, you have, pretty safe to say that they'll develop some sort of cognitive symptoms or something like that, right?
If CTE is diagnosed?
If CTE was diagnosed, right? So these studies that you initially mentioned said, okay, well, if they play before 12, they're at increased risk of developing CTE per the autopsy that they did.
Yeah, retrospective studies, yep.
So an answer to that was doing prospective studies where, they looked at the similar parameters, and then they just looked at the symptoms in living people who were still alive, whether they had, symptoms, cognitive issues and cognitive symptoms, which if you had CTE, right, and it was affecting you, right, neurophysiologically, then you would have symptoms, right? So that's the disconnect,
Yeah.
right? That's the unanswered sort of question still,
Yeah.
right?
Yeah.
That contradictory sort of
The
result.
other, there's, I think, another interesting point there that people who have stages 1 and 2 tend to be, at least in the brain bank studies that are autopsied and developed and shown to have CTE pathology, those who have stages 1 and 2, some of them are in their older years. They're not 30, 40, they're 50, 60, 70, which suggests that maybe in those cases, if this is a progressive condition, they didn't progress. And I think that that's an important point because we don't actually know how to correlate in life the exposure history with whether they're going to develop symptoms or a progressive condition.
They didn't progress, or they just started developing or depositing tau in their brain a lot later in life.
Right, which would kind of be odd neurophysiologically when you're thinking about the exposure of this trauma and then a delay of 30, 40 years before the development of this specific neuropathology. It is known that there is a mild increase in dementia risk with certain exposures, like concussion, mild, moderate, severe TBI, and repetitive head injury.
Right.
All-cause dementia is slightly higher in individuals who've had those types of histories. Those studies aren't perfect either.
Right.
Nevertheless, when thinking about the CTE pathology, whether head injury exposure will definitely cause the deposit of this abnormal tau that will build up and that becomes symptomatic, 5, 10 years later, and then progress into very symptomatic and then severe dementia, and then cause death or lead to, have a death leading from some other cause and find CTE on the brain. That is not well worked out at all.
Right.
And so it is very possible that some people are more predisposed to developing that neuropathology, despite having equal or more head injury exposure than someone who has developed it, and then some people are resistant to developing it, or resistant to progressing, or have had certain behavior or lifestyle or genetic factors that have protected them against developing or progressing. And so I think that is the glimmer of hope. That is the argument against the idea that if I had a head injury exposure history and I'm developing symptoms in my 30s, 40s, that is CTE and I'm doomed. That's the last thing I think people should be thinking who have had that exposure history. I think they should be thinking, I'm having symptoms or changes that weren't there before, and I must kind of do what is necessary to chase down and resolve those symptoms if they're resolvable, and then optimize my brain's health in ways that has been proven. And maybe this condition will not onset or progress, or maybe we have it wrong altogether, but we don't know. And so I think to be protective and to go after the things that are reversible, that we know how to diagnose and treat today, like anxiety, like nutritional deficits, and mood disorders, we can go after those things, work with an individual, reverse some of those conditions, or ameliorate symptoms, and allow them to live a normal life for a period of time. So I think there's a lot to do.
Yeah, I think so too, including getting through this article, man. We got to get through this article. And we're going to get to the doom and gloom of CTE diagnosis and the need for hope a little bit later.
That's good.
Yeah. So let's see. So Adam's sister, Lauren, told this article that, or this news company, that Phillip Adams' behavior shifted dramatically over the last couple of years, right? His mental health degraded fast and terribly. There was unusual behavior. I'm not going to get into all the symptoms. We definitely did notice signs of mental illness. That was extremely concerning. That was not like what we had ever seen. He wasn't a monster. He was struggling with his mental health. What do you think about that? I think, I mean, talking to the NFL guys, they have a really difficult time after retirement, and mental health is a big struggle for a lot of them, right? So, but I want to hone in on where was it? We definitely, just how unusual the behavior was, and how different from his usual behavior, his mental health and some of the behaviors he was having were, right? So with mental health, is there, typically maybe there's some semblance of what the person used to be, but how he just so quickly degraded and he was just such a completely different person. Does that point to anything else? I know mental health can be pretty hard. What do you think?
Yeah, mental health conditions can onset at any time, and retiring from football is a trigger, or retiring from anything really is a trigger. But it becomes less and less likely with age to develop a completely new mental health issue. So there's a lot of factors here. I think that the case in general and this statement about his behavior as being different than they had ever seen is an important piece of data that we should be taking these complaints seriously and following these patients who have behavioral changes, helping them get the support and resources they need, whatever the cause, ASAP, and not making it difficult for them to get that help. And so, the idea of seeing a physician that's understands CTE, understands the limitations of that science, and can diagnose other things that could occur in any individual that's 30 or 40 that is related to a behavioral change or a cognitive symptom is important, so that they can get the help they need, get the perspective they need, and then get the monitoring. And maybe we'll find that the condition's reversible or progressive, and they can be kind of cued into resources they need.
Excellent point. And that brings up the next thing. Adams was desperately seeking help from the NFL, according to a statement from his family that was read during the press conference, right? So, he was seeking help, and I think that's a great bridging point that you made, which was we need to be able to have accessible resources to these people, right? Whether they're retired athletes or not, right? Certainly, mental health is a huge issue, whether it's, dementia or whatever, right? If you're in a mental health crisis, or, if you're declining fast due to a dementia, it's really difficult to sort of pick yourself up and do the things logistically that you need to do. Right.
There are a number of conditions that are isolating for an individual.
Right.
The onset of a dementia or drug use problems or other mental health conditions can isolate an individual and then leave them less likely to get the help they need. And so it seems like, from my understanding of this case, that's what occurred.
Yeah.
And that's devastating. It's the last thing we want.
But I really want it, especially, we're doing this podcast and everything. But that's a huge learning point from this case, right? Like, if we get anything out of this case, I think it's the fact that resources and help has to be accessible to people, right? You're running in circles if, you have to go here, you have to go there, whether you have to jump on a plane, right? But you can't change your own clothes. Like, there's just such a disconnect there.
Yeah. I'll call out BrainSPORT and as well as the Concussion Legacy Foundation and other local neurology clinics and things like that as reasonable places to go to get that help. Yeah. And so a family member, I think it was Dr. McKee who mentioned in the press conference that family members need to be very involved in these cases of anyone who's developing a progressive condition or a change in behavior or cognition, whatever the cause, because that patient may or may not be able to actually go through with accessing the resources, jump through the hoops and everything like that. And so coming to a place that understands that can dramatically facilitate that.
Now, what I don't want to do is I don't want to say that Phillip Adams' family was not there for him or anything like that. I don't think you're making that statement either, right?
No.
But I think it's just a learning point of how things can evolve so quickly. Yeah. Right? So, all right, let's move on. After going through records from his football career, we do know that he was desperately seeking help from the NFL, was denied all claims due to his inability to remember things and handle seemingly simple tasks, such as traveling hours away to see doctors and going through extensive evaluation. According to a family statement read by Lisa McHale of Concussion Legacy Foundation that supports those affected by CTE, we now know that his deficits were most likely caused by the disease. What do you think about that?
So that's what the family's saying, and
I don't know if the family said that. I think Lisa McHale. It's kind of whatever. It's
the
it's
family
nondescript.
wrote Lisa McHale a statement, and she was reading that.
Okay, got it.
I think it's reasonable to be concerned that that's the case, but as we talked about already, it's multifactorial in most cases, and there are a lot of things that can lead to this type of behavior, and usually it is a lot of things all colliding. And so I would just caution that anybody who's having symptoms like that, anyone who's noticing symptoms like that in their loved one, seek help immediately.
Right.
It is not always related to something progressive. It might be reversible.
But yeah, we have to be able to figure it out with people that know what they're doing. So Adam's case has fueled ongoing talk about the apparent link between CTE and violence. And then they bring up suicide of Junior Seau, who was suffering from CTE when he killed himself in 2012. And then they bring up Aaron Hernandez, which we already talked about. Now, this is an important study that I think I see cited constantly in the media. And I think it's really important to translate this study and the results for people, okay? So it says, in 2017, the Boston University CTE Center reported that 110 of the 111 players they'd examined showed they suffered from CTE. What does that mean to you? Do 110 players, NFL players, randomly chosen, had CTE out of 111? I don't think so, right? So I think that's the selection bias that we referred to earlier, right? These were 111 players, again, that their families thought something was wrong with them in terms of any sort of behavioral issues or any other signs or symptoms, and they had a history of repetitive head injury, so that caused them to then go to BU and donate their brains, right?
Exactly. So the other family members of NFL players who passed away around the years that those brains were accumulated in the brain bank did not donate their loved ones' brains, and so we don't know the denominator of the number of cases that were found to have CTE and those that had the same head injury exposure but were not found to have CTE, because we don't have the full picture. But Dr. McKee and colleagues don't propose that we do know prevalence or incidence, and so but when you pick it up as a headline, 110 out of 111 or 99%, it's traumatic, and I can imagine that any NFLer who's retiring and having any symptoms whatsoever is going to think that I'm one of the 110. Right,
exactly. Let's keep it moving. So, and I want to wrap this up pretty quickly, but I think that we both agree when Dr. McKee says this: the holy grail of our research would be to find a way to detect CTE in living people, because it would provide the ability to monitor how the disease is responding to specific therapies. Right? I think we agree to that. Yeah. We can monitor progression. We can monitor what helps, what doesn't help.
I'll just say I thought that was a fair article. There's some areas where they, I don't think sensationalized, but just chose quotes that were not representing the full extent of this case.
You don't think saying 110 out of 111 NFL players that were examined had CTE without giving any sort of context there? You don't think that's sensationalism? Or is sensationalism just too harsh of a word that you
I don't know. That might be much. Yeah. I think that's for me to judge. But bottom line is there are more sensational media titles out there about this case and about others like Antonio Brown that suggest that the case of Phillip Adams was severe CTE, for example, which is a misrepresentation.